Hello everyone. I'm Nikita Kohli, a geopolitical intelligence analyst at MitKat Advisory Services, and I'm back to discuss the COVID-19 numbers in India with you. I will be looking at the numbers of 23rd July, which will be the first week that we are discussing when India has crossed 1 million cases count, and we will be seeing how that has impacted the way things are in India, the way the businesses are, the way people can move, and what is going to happen next. Delving into the nationwide analysis, we see that the number of confirmed COVID 19 cases in India has now crossed 1.2 million cases. With this, India continues to retain its position as a country with the third largest number of infections in the world, behind only the US and Brazil. Despite that, the number or the percentage of active cases continues to decline. We presently have just about 34% active cases. The doubling rate in India has seen a slight slowdown to 21 days, which from the 20 days about for the past 3 weeks. The per week growth rate of COVID 19 cases in India has seen a slight decline. That is, the curve of growth has seen a slight decline, despite the fact that we have seen more than 34,000 new cases every single day. That is, the number of new cases that we're noting every single day has seen an increase over every week till now. The single largest day increase was on 22nd July with over 45,000 new cases. When we look at the death caused due to COVID 19, we see that as of 23rd July, there were just below 30,000 deaths due to the infection. Despite that, despite the increase of so many additional deaths, we are seeing that the case mortality rate in India remains quite low. It is about 2.4%. It is exceedingly low and an ode to the way that the medical community in India is working with the disease. This is despite the fact that we are seeing about 600 about additional deaths every single day, and 22nd July even marked the highest per day increase in deaths, with over 1,000 deaths in a single day. It is again in the nationwide trends that we see interesting developments. We have once again marked the biggest per week increase in cases. And despite that, the number of recoveries has grown by almost 200,000 in this 1 week. That is nearing about 800,000 recoveries. And with this, we have a recovery rate of over 63%. It is absolutely commendable. When we look at the testing numbers, we see that as of 23rd July, more than 15 million samples have been tested for COVID 19. About 350,000 of these have been done in past 24 hours alone. This is an increase of about 50,000 additional cases from last week. The test positivity rate in India has, however, increased by more than 1% to about 8.21%. This was earlier for a very long time, for about 5 or 6%, and for the past 2 weeks, it had been around 7%. This is due to the change in testing cultures that we are seeing, that a lot of it in multiple states, for example, Maharashtra and other states, Maharashtra, Bengal, and Andhra and other states, we are seeing contact tracing, because of which the test positivity rate in India is increasing. But what we are also seeing is a stretching of the curve phenomena continuum. That is, certain states are seeing a further increase in cases while others are seeing a decline. With this, we will see certain cities and certain states now having more restrictions imposed in a targeted manner. For instance, Pune. The effect of lockdown, however, remains disputed as the number of cases has not significantly declined because of restrictions or the increase in that, but because of the way people are handling it. For example, the sero surveys conducted in Delhi have shown that about 23% of people have been exposed to COVID 19. This is much higher number than previously believed, and lets us to an understanding that transmission of the virus is happening by multiple asymptomatic carriers. Please remember that Delhi was one of the first states in India to see a lockdown before even the national lockdown began in March. Tamil Nadu and Maharashtra have also now started conducting plasma therapy after noting positive results in Delhi. it is expected to show a lot of positive results in these states as well. And though we can say that the numbers will continue to increase in the coming weeks, the number of recoveries are expected to increase as well, and the percentage of active cases is expected to decline in the coming days. When we look at the micro level analysis, we see that the top five states of Maharashtra, Tamil Nadu, Delhi, Karnataka, Andhra Pradesh now contribute an even lesser percent of all COVID-19 cases in India. That is, they're now contributing to about 64% of all cases from the earlier 70% plus. These five states also have the highest number of fatalities, and unfortunately, which is an interesting thing to note though, that they contribute to almost 78% of all fatalities in India. So that is that despite the number of uh, cases declining in these states, the number of fatalities is maximum in these five states alone. The major nine metro cities, that is Delhi, Mumbai, Chennai, Pune, Bengaluru, Hyderabad, Ahmedabad, Kolkata, and Gurugram, continue to have the maximum caseload among the cities. They together contribute to about 41% of all cases in India. What is most important to note in this week has been the developments in Pune. Pune had seen a sharp increase in the month of July, with close to 200% increase in the first 23 days, which is extremely high. About 35% of this increase in COVID 19 cases was in the last week alone, and it has over 60% active caseload. It has seen a sudden turn for the worse. It has surpassed all the cases in Mumbai. The doubling rate is increasing, and it's almost the number of new cases, double the number of new cases in Pune as compared to Mumbai. It has recorded over 2,600 additional cases every single day, and 22nd July marked the single largest increase with over 4,000 cases in Pune alone. The sudden increase has led to a major impact on the district's medical infrastructure, which has not been developed enough to anticipate this level of COVID 19 infections. So, at least five people have died due to waiting for COVID 19 uh, treatments in hospitals this week. Bengaluru too continues to be a sad case, and the number of cases are expected to increase in the coming week. We will now see an increase in restrictions in these cities. However, these restrictions are not expected to impact business operations. The reason for that is that all of these restrictions are based on the movement of people between districts and not so much for business restriction. That is, people are moving and understanding that there is a new normal which needs to be understood. However, there will be certain impact on business, and if you're reopening your offices in India, please reach back to us to know how MitKat can help you. Until next week, take care and goodbye.